Welcome back to my channel. As you have already seen, this topic is going to be a very delicate one. Vaginal smear during pregnancy. This topic is going to be a very delicate one, but most women experience this, and you may have been asking questions to yourself, to your doctors, and some women are not bold enough to come and ask questions about this. They just browse about it because it's a very delicate question which not all women are proud of. Now I'm going to be talking about it. Let's be more open and realistic. Yeah, during pregnancy there's always something called vaginal smear during pregnancy. Now, before we go into what to do to cure it and what not to do, what may be the cause of this vaginal smear? Is it infection? Is it that the woman is dirty or something? What could be the cause? Now, number one cause of this vaginal smear is the fact that you're pregnant. Your hormones are there. You're sensitive to smell, like any little things. Why do you think when you're pregnant, if someone or your husband come close to you, be like, ah, baby, have you brushed? But before then, you don't notice anything. Someone spray perfume, you're reacting to the perfume they spray. Why? Because your hormones are reacting to so many things. So that is the reason why you could easily notice, oh, there is something odd about those things. What could be the reason? So first of all, it may be that there is no problem, there's no bad smell, just you not being comfortable with it because of your condition, and there's everything totally fine with it. But what you need to do is, anytime you notice any of this, no matter what it is, it's better you go to the hospital and they rule out infection before you can now sit back and say, okay, maybe it's my condition that is making me perceive this the more. Then secondly, the causes of this vaginal smell is infection. Women, when we are pregnant, we use these different toilets. I did it during that my first pregnancy. I'll go to the market, to the extent of using market toilet, just because, you know, every minute, every just 30 minutes you're urinating. Whether you drink water, you do not drink water, you just want to use the toilet. And if you're out of the house, if you're someone that is not always at home, anywhere you see any toilet, you may just want to use it because you really want to ease yourself. So because of all those things, you may contact infection during that. Now, what do you do when you notice the smell? First of all, of course, they said anything in pregnancy, you must go to the hospital, you must talk to your doctor, because you don't treat yourself when you are pregnant. Now, when you've gone to the hospital and they did examination and they realize, oh, you have infection, because sometimes I don't think there is a way they will do those things that infection will not be there. Okay, let's say they have done everything they needed to do and they realize, oh, there is infection. What do? Do you just relax and allow the doctors treat you, or do you take charge of your own treatment or go extra mile to check? Now let me tell you something. In my first pregnancy, when I went to the hospital, I told the doctor what I was experiencing. The doctor checked and said, oh, there is infection. I said, okay. They packed so many drugs for me. What I did, I started checking it one by one. Yes, don't trust all the doctors, don't trust any hospital. Make sure you check and browse and make sure it is safe for pregnant women, and also ask questions. Then during my second pregnancy, the hospital did not really give me more of injection, like more of tablets to take in. What they gave me was, there is one you can insert, so you can always use that one. I think that one is safer, because my first pregnancy, there are some issues with my baby. I don't even know if it's it, I don't know where it's coming from. So because of that, I told myself that any hospital I'm going to and they give me tablets to take in, I'm not going to take in those tablets, whether I browse it or not. No, I'm not going to take it in. So I prefer those inserting ones. Thank God my second hospital gave me the one to insert, and I did it and everything went on perfectly well. So once you're talking, you know, they will always pack, because some of those medicine, or yes, they are giving to you, is coming from their hospital and they really want to sell. So most times, make sure what they are giving you is what you need for that particular period. This my third pregnancy, I did not experience anything of such. Okay, baby was even okay when baby was born. There was no infection, nothing. We were totally cool. So if you are a mother or you're pregnant and you have been experiencing this, please don't beat yourself too much. There's always solution. Once you notice, go to the hospital. Then once there is no infection, they check and they say, oh, there is no infection. Then you know it's the other way around. It's just you being so, or your sense organ being overly active to perceive all those things. I hope this message have helped you. Thank you for staying tuned. Remember to always come here for anything concerning your baby and your child. Thank you, and support this channel by subscribing. I love you guys.